Hello everyone, welcome to another interesting episode of the Anti-Pharmacist podcast. Well, it's TGIL guys, and I hope that you've had a nice week so far. Well, this past few days, the whole healthcare space has been agog with a major news which has received mixed reactions from various quarters. The future of global health seems uncertain, and there are speculations here and there. Today, I'd like to address it and bring some clarity, okay? Because in the long run, global health is everyone's business, either you like it or not. It affects you one way or the other. So it is better to be aware so that you can know how to safeguard your health. That being said, the big news, that is if you don't already know, is the United States of America's exit from the World Health Organization since the change of government on the 20th of January. Well, it is not like they have exited completely, but they are in the process of. However, according to the WHO, they are looking to explore dialogue to ensure this relationship, which has spanned decades, is not severed. But what if the US president refuses to yield? I'm sure that you are interested, right? Or are you not? Well, you should be. So, let's get right into it. The World Health Organization is a specialized agency of the United Nations which is responsible for global public health. They have their headquarters in Geneva, Switzerland, and they have 6 regional offices with 150 field offices worldwide. It is the largest intergovernmental organization concerned about health at the international level, and their responsibility is achieving the highest possible level of health for all of the people in the world. Their main function includes promoting the control of epidemic and endemic diseases, providing and improving teaching and training in public health, the medical treatment of diseases and related matters, and promoting the establishment of international standards for biological products. Of course, we know that the World Health Organization is the organization tasked with the responsibility of ensuring global health is maintained and preserved. That is, they look at eradicating diseases, different types of diseases all over the world. They have sentinel sites in each country. They have collaborators in countries. They collaborate with different governments to help fight diseases, to help curb the spread of diseases, and to even prevent the emergence of future diseases. Okay, that is basically what the World Health Organization does. As of January 2025, WHO has 194 member states, all member states of the United Nations. So virtually all the countries in the world are members of the World Health Organization. And the top 10 contributors to the World Health Organization's funding are Germany, United States of America, Bill and Melinda Gates Foundation, United Kingdom of Great Britain and Northern Ireland, Gavi Alliance, European Commission, Japan, China, World Bank, and Rotary International. They have regional offices in Africa, which is in the Republic of Congo, in Europe, which is in Denmark, in Southeast Asia, which is in India, in Eastern Mediterranean, that is in Egypt, in Western Pacific, the Philippines, and the Americas, the United States. But now, the United States, which is one of the countries involved in the World Health Organization, has decided to pull out, or rather, the current president has decided to withdraw the United States from the World Health Organization. Why, you may wonder? A little backstory, okay? It all started in 2020 after the COVID-19 pandemic became widespread all over the world. The current president of the United States, who was the then president, believed that the virus originated from a particular country, and the country was not sanctioned. It believed that the spread of the coronavirus could have been prevented if that country was well managed and dealt with according to him. Also, there was dissatisfaction with the way the WHO handled the COVID-19 pandemic and other global health crises. So, an attempt was made then to withdraw from the WHO, but the president wasn't re-elected. Therefore, the elected president then reversed that withdrawal because he didn't deem it necessary and he didn't believe that the WHO was complacent and that they did not do their best in addressing the virus spread as at then. However, it seems that the inevitable has eventually happened to the World Health Organization because the otherwise dead withdrawal has been resurrected again, since the president then who wanted to withdraw has eventually taken office again. So 5 years later, WHO faces the challenge of losing one of their largest donors, the United States, yet again. First, what role has the United States played in WHO so far? Since the inception of the World Health Organization in 1948, the US has played crucial roles in helping to eradicate various diseases. As one of its largest donors, the US has provided leadership in global health initiatives through American institutions affiliated to World Health Organization, contributing expertise across fields like cancer, mental health, nutrition, chronic disease management, and even neglected tropical diseases. And let me let you know that yesterday, January 30th, was World Neglected Tropical Diseases Day. These neglected tropical diseases are viral, parasitic, or bacterial diseases that mainly affect the poorest people in the world. Most of them are found in the tropics, okay? They are the likes of Chagas disease, schistosomiasis, filariasis, hookworm infections, tapeworm infections, dracunculiasis, leishmaniasis, rabies, river blindness, sleeping sickness, even snake envenomation. Okay, they happen to people who do not have access to clean potable water and even clean environment. Okay, much attention is not paid to these diseases, but that does not mean that they do not affect thousands, if not millions of people. And the WHO has taken it upon themselves to take care of these diseases, to ensure that they are treated and to possibly eradicate them with the help of their partner organizations and countries. In order to avoid these diseases, you must ensure that your environment is clean, ensure that you take clean water, reduce exposure to muddy water or dirty rivers that are not flowing. Also, limit your exposure to animals, especially ones that are not domesticated, because rabies are contracted from infected animals' bites. And if you happen to be bitten, the best option for you is to go to the nearest healthcare facility, a standard one, get vaccines. Either the animal is rabid or not, that's the best thing for you to do. Also, if you get bitten by a snake, you should go get anti-snake venom as soon as possible. Do not wait and say you have tied a tourniquet on it or something. It could be fatal, okay? You should even prevent snake bites by not going near bushes and ensuring to wear protective clothing, especially for those that work on the farm. And for the worm infestations, you should deworm regularly to prevent that, okay? I have talked on deworming on an episode on this podcast, so you can refer to that. Well, I've digressed, right? Let me now go back to the main issue of today, which is WHO and US saga. I was talking about the US contribution to WHO, right? Yes, let's take it from there. Specifically, the United States has been a key partner in several WHO initiatives and programs, such as polio eradication, in which the US has been a major supporter of the Global Polio Eradication Initiative, helping to reduce polio cases by over 99% since 1988. Also, they have been instrumental in smallpox eradication, in which they played a crucial role in the global effort to eradicate smallpox, which was declared eradicated in 1980. The US has also contributed significantly to the Global Fund to fight AIDS, tuberculosis, and malaria, supporting HIV prevention, treatment, and care programs. Also, the US provided substantial funding and technical support during the Ebola outbreak in West Africa, which help to control the spread of the virus. The US supports various programs to strengthen health system in low and middle income countries, improving access to essential health services. Also, the US has funded vaccination campaigns for diseases such as measles, rubella, and hepatitis B. The US has been a key partner in WHO's emergency response efforts, providing funding and expertise during health crises like the COVID-19 pandemic. In terms of nutrition, the US has supported initiatives to address malnutrition and improve maternal and child health. In terms of mental health initiatives, the US has contributed to programs aimed at improving mental health care and reducing the stigma associated with mental illness. Finally, in chronic disease management, the US has funded programs to manage chronic diseases such as diabetes and hypertension. Over the years, the US involvement in all these aforementioned programs have received mixed reactions globally. There has been several conspiracy theories about global health and different agendas of the donors in particular. Now that the US has withdrawn its support, has this withdrawal created room for these speculations to be brought to the surface and re-examined? There have been rumors all over about vaccines used to control fertility, rumors of diseases like cancer deemed untreatable by Big Pharma in order to gain dominance and all sorts. Well, that's not the focus right now. The immediate implications of the US exit are of utmost concern, especially to people interested in public and global health. So what are these implications? Let me attempt to state them as simply as possible. First, this withdrawal will jeopardize programs across the organization, especially those tackling tuberculosis, malaria, and HIV/AIDS. The US fund that donates free HIV medications to many countries, called President's Emergency Plan for AIDS Relief, PEPFAR, has been withdrawn. This will negatively impact the fight against this disease, which may reverse all the achievements made in the control of HIV/AIDS thus far. Similar setbacks are predictable for the successes already achieved in combating neglected tropical diseases, polio, smallpox, malaria, and even in the future plans to eradicate them. These are precarious times for public health. Secondly, the US withdrawal may weaken international collaboration and health diplomacy, making it more challenging to address global health crises. We all know that diseases have no borders. Past pandemics like Ebola and COVID-19 has taught us that the sharing of data and information about diseases, especially amongst researchers, may be negatively impacted, making it difficult to control disease spread. Overall, the US exit from the WHO threatens to undermine global health security and the ability to respond effectively to future pandemics and health emergencies. Having said all this, what then is the way forward? In my humble opinion, it is high time each country takes responsibility for its healthcare, not expecting hand-me-downs or financial aids from global organizations. Maybe this is a good thing, which will prompt our leaders to focus more on healthcare and prioritize it in their budgets. At least I hope so. Because the lapses covered by the WHO, whose funding has suddenly taken a hit, will be so obvious if they don't step up. However, the exit of the US from WHO doesn't mean the organization has ceased to exist. As I've said earlier, the US, although one of the largest donors, is not the only donor. Okay? Another country may even take the place of the US as the largest contributor if they so wish. But each country, especially in Africa, should look at ways of improving their healthcare internally. Collaborations are still possible between countries. Anyway, they could even have WHO as an external partner, but not as the major decision maker. It is high time for ministries of health and NGOs to wake up to the task. In all of this, my advice to you is to guard your health diligently so as not to be at the mercy of health organizations and their policies, because prevention is always better than cure. And that is it for today. Okay, ruminate on all these things and let me know what you think about the US exit from the World Health Organization in the comments. Now to the big announcement. Drum rolls! Introducing a new segment to the Anti-Pharmacist podcast TGIF episodes. It is called Dear Anti-Pharmacists. This was born from the correspondences I received via mails and DMs from many of my listeners. On this segment, I'll be commenting on questions that I received from the audience about their health, experiences in pharmacies or with pharmacists, and such like. So be sure to send in yours to me in the DMs or via mail at antiPharmacistPodcast@gmail.com. The first Dear Anti-Pharmacist segment will air next TGIF episode, which is next week Friday, so watch out for that. In other news, be sure to engage me on social media because I have very interesting things lined up for you this year, like I promised. I have started a short series called Pillow Talk, in which I share my own experiences in a more relaxed and entertaining manner. So, follow Anti-Pharmacist Podcast on Instagram, TikTok, Facebook, and please subscribe to my YouTube channel to get all of this. I promise that you will have not just a healthy year but an entertaining year as well if you follow the podcast. As always, I encourage you to share this with as many people as you can so that they too can be armed with the information I've shared here today. Thank you so much for listening up to this point. Enjoy your weekend. Till next time, stay healthy and God bless you.